One thing that is new within Medicare plans are the effects of the Inflation Reduction Act. The Act includes some key changes to Medicare that impact all beneficiaries, but it can be confusing for anyone gathering information as they make their Medicare plan decisions because many changes are not being implemented until next year or even later. One important change that is starting now is a cap on insulin costs of $35 per month, including for residents here in Massachusetts. About 1/3 of Medicare beneficiaries in the United States are diabetic, so this is extremely important for so many individuals who have struggled with the rising cost of insulin. Other relief from out-of-pocket drug costs, which can be catastrophic for many seniors, will be phased in starting in 2024 and beyond. We encourage all Medicare-eligible individuals to look closely at plan options each year. As their health evolves and new health plans enter the market, they may find a plan that better meets their unique needs. Medicare is a federal health insurance program funded by the government available to people age 65 or people at a younger age who have been deemed disabled for 24 months. However, contrary to popular belief, the program was not intended to cover all healthcare services at no cost. Rather, it provides a core set of basic medical benefits to cover inpatient and about 80% of outpatient care. A hospital admission would be an example of inpatient care, and a specialist visit would be an example of outpatient care. Medicare Part A covers basic inpatient hospital services. For most people, there is no premium, but there is a deductible and some coinsurance costs for extended inpatient hospital and skilled nursing facility stays. Medicare Part B covers all doctor care and outpatient services. There is a monthly premium that is usually deducted from your Social Security check, an annual deductible, and typically coinsurance of 20% for most services. Medicare Part C plans are offered through private insurance companies who have contracted with Medicare to cover all of the benefits of Part A and B, as well as additional benefits, and may include Part D prescription drug coverage. These plans provide greater care coordination and additional benefits like dental, vision, and hearing coverage. Medicare Part D plans are offered by private insurance companies that are contracted with Medicare for prescription drug coverage. Plans vary in their costs, deductibles, and covered drugs. Enrollees may pay monthly premiums and some of the cost for their prescriptions. The Medicare annual enrollment period, which starts October 15th and runs through December 7th, is the time during which Medicare-eligible shoppers can join, switch, or drop a plan. It's the most crucial time to learn about Medicare plan options and benefits and decide which plan is best for you and your unique needs. It's also an important time for family members, friends, and other caregivers to assist in assessing Medicare plan options for those who are eligible. We encourage caregivers to visit websites of different carriers so they can help their family members, friends, and neighbors assess the options. If you miss the annual election period and you have a Medicare Advantage plan, you have another opportunity to make a change from January 1 to March 31. This is the Medicare Advantage enrollment period. During this time, you can switch to a different Medicare Advantage plan or drop your Medicare Advantage plan and go back to original Medicare A and B. If you go back to original Medicare, you can enroll in a Medicare prescription drug plan. There is also a chance to enroll in Medicare Parts A and/or B for those who missed their first opportunity during the initial enrollment period. It's important to know where to find the right information and guidance. Medicare is complicated, so we encourage Medicare-eligible individuals to understand the basics and how the system is structured before they start to shop. There are also a lot of Medicare plan options here in Massachusetts, which can make it challenging to navigate the enrollment process. In addition to national health plans who market their options here in Massachusetts, there are quite a few Massachusetts-based plans and organizations who have offered Medicare plans in this state for many years. Medicare-eligible individuals can visit our website, bluecrossma.org, and click on Medicare to find information about our plans as well as an introduction to the basics of Medicare. We also offer a wide range of informational seminars, both online and in person, hosted by our Medicare experts who can answer questions about the process for choosing a plan or about our offerings. When people understand Medicare and their plan options, they can make informed choices for themselves or for their loved ones. If individuals seeking Medicare this annual enrollment period find a plan that works and that they can afford, they will be more likely to take advantage of their benefits and stay healthy in the long run. There are generally two groups of 65-plus seniors who are shopping for a plan: those who are already on Medicare and may be shopping within their current carrier or across carriers, and those who are aging into Medicare and going through the initial enrollment period. While you are not required to enroll in Medicare, it's important to understand your options at the time of eligibility. Late enrollment penalties may apply if you choose not to enroll when initially eligible and are not covered by an employer plan. You may also qualify to delay your insurance if you work for a company or organization that employs 20 or more people. If you delay your enrollment while not covered by an employer plan, your Part B monthly premium will permanently increase 10% for each 12-month period you could have enrolled but did not. However, if you get insurance through your job or your spouse's, then you don't have to pay the penalty.